For more than 100 years, San Francisco's City Clinic has been providing locals with an array of women's health and sexual health services. Today, members of the LGBTQ community plan to hold a demonstration there. This was in response to the mayor's office saying it would cut funding for planned improvements at this aging facility. But tonight, that didn't happen. It's actually a celebration. Let's bring in NBC's Sergio Quintana in San Francisco with the very latest. Sergio.
Yeah, Raj, this was a demonstration that started about 5 o'clock or so. And as you mentioned, there was originally supposed to be a protest over the mayor's decision there. You can see right now there are a few people here, but let's go ahead and show you some video of that demonstration as it started about 5 o'clock this afternoon. About 40 or 50 people turned out for this demonstration that then turned into a rally. The concern was that the city clinic bond money was left off of a city bond for voters to decide in November. But this afternoon, according to the mayor's office, it's back on the bond. For decades, the San Francisco City Clinic has been housed in a former firehouse in the city's South of Market district. But as the facility ages, their ability to help anyone who needs it has been eroding. The facility needs money to renovate and was banking on being included in an upcoming bond issue, but we're told they'd be cut from it. Today, all that changed when the mayor's office announced that a new evaluation from the city controller has put the clinic back on the November bond.
City Clinic is in, which means it'll be part of the bond the voters consider in November, as well as improvements to Laguna Honda, to General Hospital, to Chinatown Health Clinic.
To be clear, city funding for the existing clinic and its operations are not at risk, just the funds needed to improve it. The site serves about 80 patients a day for a variety of sexual health issues, including testing and treatment for sexually transmitted infections, pregnancy counseling, and some medications at no cost to the patient.
If you have insurance through Medi-Cal, we send a bill to Medi-Cal. But otherwise, the services are provided at no charge to you.
But concerns over funding for the clinic began brewing earlier this week when capital outlay projects were first detailed. Jeffrey Kwong is president of the San Francisco Harvey Milk LGBTQ Democratic Club. He's critical of the mayor's initial decision to leave the city clinic off the bond issue.
This project was slated to be on the November 2024 bond, but the mayor in the 11th hour decided to pull it out and put in her own pet projects. We think it's her political move since she's running for re-election.
According to city documents, the Department of Public Health has been considering whether to move the aging city clinic to 333 Valencia Street. That's where a women's health clinic is currently housed. But if voters approve the bond issue, it will move to a city-owned building or a site will be purchased to suit the clinic's needs. Again, a celebration from this group. They say that this is a big win. Now, if voters do approve the bond in November, it will not increase taxes for residents of the city. Reporting live in San Francisco, I'm Sergio Quintana, NBC Bay Area News.